Hi, I received an intestinal vaginoplasty from Dr. Corral in Baltimore, Maryland. I'm here to give you some information on what to expect once you leave the hospital and start your recuperation. Let's start with pain management. My experience when I received this surgery, the first couple of weeks I relied on my pain medication religiously when it was required, but the pain was not as bad as I expected it. After the first 2 weeks, it subsided significantly between 2 to 4 weeks, and after 4 weeks it was significantly less, and I relied on just over-the-counter medications to get me through that. So the pain, from my perspective, was not as bad as what you might expect. So the second thing that I want to talk about is vaginal dilation. In my case, I was required to dilate just once a day for 20 minutes a day from the time I got home up to 3 months during recuperation. I did it in the morning before my first shower, and I was allowed to focus on the incision area instead of the whole vaginal canal because of using the intestinal material instead of using other material to build it. After the 3 months, I went to once a week, and so it made it a lot easier for me. Instead of having to focus so many times on dilating, I was able to concentrate on other things and recuperating and getting up and walking and doing things that I really enjoyed doing. The third thing I want to talk about is vaginal douching. In my case, I douched every morning after I did my initial dilation in the morning and at night before I go to bed. And it's really important that you follow your doctor's directions and douche the amount of times that he tells you to do a day. You don't have to do it more, even when you start smelling funny things coming out of your body. And you will have smells. For the first month to 2 months, there is a odd odor that comes out of your vagina. It is completely normal. Once the discharge stopped, in my case, the smell stopped. And I was able to go on, and I continued douching all the way up to 3 months. After that, I still do it just once a day, just because I like the clean feeling. But depending on what your doctor says, you may be required to do it less, or you may be required to do it more. And the last thing that I think that I want to talk about is Medi-Honey. In my case, I learned about Medi-Honey about 2 weeks into the process. I was having pain when I was trying to dilate, and Dr. Corral suggested that I go get Medi-Honey. Problem was, I couldn't find it anywhere. None of the pharmacies had it. Discount pharmacies didn't have it. So I tried to get it on Amazon, and there was a 3 to 4 week delivery process just to get it. Luckily, I did find it finally one place, which was about 50 miles from my house. Once I started using it, it was a miracle. It made dilating so much easier, and it made the whole process a lot easier, and I think it helped with my healing process.